Hi, good afternoon, everyone. My name is Dr. Gauri Kulkarni. I head the medical operations at MediBuddy, and today we are getting together to talk about a very important and a trending topic that we all are so much awaiting for, right? And that is the COVID-19 vaccine. There have been a lot of questions. We've had a lot of patients who have asked interesting questions in and around about the vaccine itself, and it's important that we, ensure that everybody is aware about what kind of vaccines are available, what are how they act, how they help us in building our immunity against the infection, and also take care of some of the myths that have been coming around regarding these vaccinations, so that we are all informed when we take our decision to get vaccinated, right? So we will be touch basing on a lot of these questions. So bring on your questions if you have anything specific that you want to ask about the COVID-19 vaccines that are available, and anything that you would want to know as we talk about it, right? So to begin with, it's important for all of us to know that it's great news that we do have a vaccine. We have multiple number of vaccines which are now being developed and being administered all over the world against the COVID-19 infection. Last year has been difficult for all of us in terms of how we have managed ourselves, our health in the times of the COVID-19 infection. Now, the COVID-19, as we all know, is an infection, primarily a respiratory infection, which is caused by the SARS-CoV-2 virus, right? We all know about that. And currently, there have been many different types of vaccines that have been developed to ensure that we are protected against this specific infection, right? Now, in India specifically, of course, there are different vaccines which have been available in different parts of the world, but let us stick to what we know and is available in India, right? Now, currently, there are two vaccines which have been made available for use to combat against the COVID-19 infection. And these two vaccines are basically the Covishield vaccine and the Covaxin, right? Now, these two vaccines are different in nature and the way they act as well. So let us discuss about each of them in detail, right? Now, we have read about all of this, and I'm sure that you guys know about it, but I think it's important that we just clarify and be very sure of information that we have. Now, the Covishield vaccine that has been manufactured by the Serum Institute of India, in partnership with the Oxford and the AstraZeneca, they have been working together when it comes to the Covishield vaccine, right? Now, this is the way the vaccine works is it is based on a technology which is called the mRNA vector technology, right? So specifically, it means that there are messenger RNAs which have been created against certain proteins which are there within the virus, and when administered, they develop antibody towards that specific mRNA which is formed in the body, right? Now, this vaccine has been commissioned for use in India. It has, of course, undergone all the phases of trials, and we'll talk about the different phases of trials as well as we go on, right? So there is one vaccine which is called the Covishield, right? The other one, which is the Covaxin, which has been developed ingeniously. Now, this is our Indian vaccine, which is by the Bharat Biotech. And it has also been commissioned for emergency usage, though it has not completed all its phase trials. The third phase are still continuing, and we are hoping for good results. But that is also another vaccine. Now, the Covaxin is basically a killed or attenuated vaccine, wherein there are killed viruses which are present, and these are the viruses which then help in building antibodies and hence giving us the desired immunity against the specific infection. Now, any vaccine, the way vaccines are produced, right? There are steps in which they are produced. So once the vaccine is produced by different technologies, whatever is available, definitely everything has to undergo testing. Now, be it anything, right? Be it medicines or vaccines, everything undergoes testing. Now, initial testings are done in animals or non-human trials, as we say. And then there are these phased human trials that happen, right? Now, phased human trials typically happen, phase 1, 2, 3, right? Now, the phase 1 is typically done in a very small group of people, less than 100 young, healthy individuals, to try to see what is the efficacy of the vaccine, or what is the efficacy of the administered dosage, and how it is going to work, right? Phase two trials usually are those which are in a much larger population, larger healthy population. And phase three is a very large population that is looked at. And in all these phases of trials, typically we try to look for what is the efficacy of the vaccine, what are the kind of side effect profiles that can be seen, and can this be given to the general public as well, right? So typically these are the steps when it comes to vaccine being commissioned for use. Now, Covishield is one of those vaccines which has undergone all the three trials, though in different parts of the world. Right, we have to understand that in different parts of the world. Versus Covaxin is in the phase three trial, but it has been commissioned for use because maybe because it's a attenuated vaccine, and also naturally the side effect profile for such a vaccine most probably would be on the lower side, right? Also, in the first two phases, it has shown more than 50% efficacy. Now, both these vaccines have been showing good efficacy and results, though it's important that we understand a few basics of how this vaccine is being administered currently, right? Now, currently in India, what's happening is that these vaccines are being currently given to the frontline healthcare workers, the frontline workers. Like, in the first phase, it will be given only to healthcare workers, and then later on to sanitation, police, and other frontline workers who are battling with the infection. And later on, it will be then it would be open to certain sections of the public, right? So initially it will be people who are above the age of 50, or who are below the age of 50 but with comorbidities. Like, we know, for example, that people who suffer from chronic diseases tend to have a higher risk of getting the COVID-19 infection, and also more complicated form of infection. So these will be the people who will be given the vaccine first, and then later on it will be the general public who would be given, right? Now, government, if you have read up, government has come up with a lot of good measures and steps in which this is going to happen. And there have been a lot of apps, COVID app, through which they are going to try and ensure that the administration is happening in the right way, right? So from a general public perspective, we may have to still wait, as it will be the frontline workers and the healthcare professionals who would be given the first line of vaccinations, followed by those who need it the most. That is the older or the elderly population, or citizens, older citizens, who will be given it first before the healthy young individuals are given, right? So this is something that we need to understand, and I think it's a good move to administer it in this manner, considering that the availability of vaccine is, of course, the supply is in staggered manner, right? It's not that it's available for everybody's general use. So it will take some time for it to come to the open market. Now, this vaccine is something that is given, the route of administration, as we say, it is both these vaccines are being given in the intramuscular, right? So they give a injection in the muscle, typically on your arms, which is called as the deltoid region. And usually 2 doses are required. So 0.5 ml is given in 2 doses, which are usually 4 weeks apart. So in India, the first round started in January, right? So the people who took the vaccine in January, they will be again taking the second round now, very soon. And then there'll be, like these, there'll be second wave of vaccines that will be happening, of course. So we are still in the phase where there is the first round has, the first dose of vaccine has been done, but the second dose will also be given very soon. Okay. And now, why 2 doses, right? Typically, if you've seen in children also, we do give something called as booster doses, right? So why is it that 2 doses of the vaccine are required? So typically, what is seen is that the first dose will help in forming the memory cells for the antibodies which are being made against the COVID-19 infection, and the second one be for consolidating that development of those antibodies. So typically that's why 2 doses are required. Now, as we all know that the testing for, or the trials have been done only in adults. Naturally, this vaccine is currently not given to any to children, less than 18 years. Nobody is being given, though there are few trials which are running, but because there are no conclusive evidences available as of today, we are restricting it to the vaccines being provided only to individuals who are 18 and above, right? So because a lot of parents are asking these questions that, um, should we get our child vaccinated? And I think it's important for us to know that currently that's not the case, but hoping that later on, as more and more studies happen, we will be in a better position to understand if children can be provided this vaccine, right? Now, going ahead to questions like who should be taking these vaccines. So specifically, people, of course, everybody should take this vaccine. And it is very important that everybody is vaccinated over a period of time. But especially, those who have chronic diseases like diabetes, high blood pressures, heart disease, kidney issues, even immunosuppression for that matter, people who are on steroids, those whose immunity is already low, or those who are suffering from chronic diseases, it is recommended that they take this vaccine. This is very, very good for you, and you should take it. A lot of people also ask that, I have suffered from um, COVID-19 infection, right? People who have already had this infection, unfortunately in the past, is it recommended that they take it? Yes, everybody should take it. Okay, everybody, it is recommended that everybody, every adult should take this vaccine. Even if you have suffered from the infection in the past, also you should take it. However, if you are currently suffering from it's an unfortunate instance that you are currently having a COVID-19 infection, you're isolated in your house, then now is not the time for you to take the vaccine, right? You should, after your infection, wait it out for another 4 weeks before you can get vaccinated. But yes, you should get it at a later date. So yes, please do get yourself vaccinated as and when that happens, when the ruling comes out and it's your turn. So but yes, it is important that everybody gets vaccinated, because it's going to only help us to ensure that our immunity is developed, right? Now, a lot of people ask, okay, can this vaccine be given with other vaccines? Because with the COVID-19 vaccine coming in, a lot of people have also gotten more aware about adult vaccinations, right? So typically the whole notion has always been that immunization or vaccinations happen only for children, right? That's what most people think, that it's only in childhood that you get vaccinated and then you don't. However, that's not true. There are a lot of other adult vaccinations which are recommended and should be taken. However, currently, because we do not have any specific data, it's always better that if you have to take any other vaccine, give it at least a 4 weeks duration between the time that you took the COVID-19 vaccine and the any other vaccine that you're taking. Like, for example, older individuals are, and especially those who have comorbidities, are recommended that they take a flu shot every year, and also they are recommended to take pneumococcal vaccines. But it's important that you kind of keep these apart when it comes to by 4 weeks, when it comes to, say, taking whenever you're going to get the COVID-19 vaccine for yourself. All right. Now, there have been, of course, the question comes up then is that who cannot take this vaccine, or what is the contraindication of taking this vaccine? Because a lot of people are not sure, right? Now, because testing, the trials have been limited, we recommend that if you are pregnant or if you're lactating, it is better that you don't take this vaccine, because we do not know how it affects the growing fetus, or even when you're lactating, if it would be having any effect on the little one. So if you are pregnant or if you're lactating, it is best that you avoid taking the vaccine. Also, anybody who is currently less than 18, or children, it's because the tests, again, trials have not been done. It's better that we, for now, avoid giving vaccines to anyone who is less than 18. Okay. Important part of the side effect profile that has also been seen as people who have low platelet count, or those who have coagulation issues, right? When it's blood clotting issues, It has been seen and it has been recommended that such individuals who suffer from either low platelets or from any coagulation disorders should not take this vaccine. Okay, so if you are one of those, then it's a good idea that you don't take it. Also, if you do have any hypersensitivity reactions, if you're highly allergic or have had anaphylaxis in the past, it's maybe a good idea not to take the vaccine, because you do not know how the body reacts to an external agent like a vaccine, right? So that could be one of the contraindications that you may have. All right. Now, there are a couple of questions that had come up, right? And I wanted to specifically address that, in terms of one question was about myths about, there was a question which said that these are mRNA vaccines. So, will they alter my DNA? This was a interesting question that had come in. And, so let me explain you what mRNA is, right? So mRNA is basically messenger RNA, okay, which basically what it does is it instructs our cells to create a certain spike protein, okay, which is found on the coronavirus. Okay, so it's like a template. Okay, if you can think of it, it's like a template which tells the kind of protein, which gives the instruction of how that the kind of protein which is present on the coronavirus is made. Okay, so when the body is able to make this, we also develop immunity, or immune system recognizes this as a protein, and it starts building up a immune response towards this. Okay, so naturally the body is kind of teaching by that immune response which is generated, our body is teaching ourselves to kind of protect itself from any future infections. So that's what happens. The mRNA cannot change our DNA or the way our body is the cellular structure of our protein body or anything like that. It cannot do that. So it's a complete myth that it can alter our cellular structure. No, it's not there. It is just a way of telling our body what kind of a protein is there on the coronavirus, and by knowing that, our body is able to mount a immune response and be ready for any kind of future infections. Okay, so don't believe anything like that it's going to alter our own cellular structure or our body. Nothing like that. It is only going to help you whenever you take the vaccine. All right, so please be um, aware about this, and do not get hassled by such kind of myths which have come up. Right now, another thing that has been said is about the side effect profile, right? Like, a lot of people have said that these viruses cause a lot of severe side effects and allergies and associated symptoms. Now, it's important to understand that, of course, phased trials have happened and people have come up with side effects which happen with a lot of vaccines. Right now, any vaccination, what happens? Vaccination is a way in which we are training our body, right? We are training our body to learn how to fight a future infection. That's what happens in a vaccination when you give a vaccination. So naturally, when you're training somebody, there will be some kind of a side effect, right? For example, say if you're training to learn a combat, right? You will have some soreness because you're training, right? So typically, that's what happens when you give a vaccination. So the most common side effects that would happen with any vaccine for that matter, and it also happens with the COVID-19 vaccines as well, which are available, is basically mild fevers or chills or muscle soreness, or injection site there might be some tenderness, headaches, aches and pains, or myalgia, as we say. These are the most common side effects that can happen. In many people, it is not even seen, right? Some people do get it, some people don't get it. So this is the most common type of side effect which is there. There have been certain reported instances where there were certain neurological issues in one case, called as demyelinating diseases, and also there were some severe anaphylactic reactions. But then these are for very, very rare, and also that's why we say it's contraindicated if somebody already has a hypersensitivity reactions in the past. So any which way, it's a good idea to avoid it if you have so. But otherwise, there have been no major side effects that have been seen The kind of side effects which are usually seen are can be treated with, like if you have a fever or a chill, plain paracetamol or a fever medicine would work. Resting it out helps. Now, this would happen with any of the other vaccines. If you've seen your children getting vaccinated, this happens with them as well with the other vaccines. So it is going to be similar when it comes to the COVID-19 vaccine. So please do not feel as if it is going to cause very severe side effects or it's going to be really bad. Though we are looking at data right now, because this vaccine is still, these are still early days and vaccinations are happening. Maybe there could be something new that's coming up, but in my opinion, there is nothing which stops us from taking the vaccine at this point in time. All right. So I hope that clarifies, a lot of doubts that people have about getting themselves vaccinated with COVID-19. There's another question that had come up, okay, and this question was about um, the new thing which has come in, that in women it may cause infertility, or in men there might be erectile dysfunction issues because of the vaccine. Again, it's a myth. There is, there's nothing which is, there have been no papers which have said that this is going to be there. There has been one obscure paper which talks about the erectile issues which may happen if you have the infection, not because of the vaccine, right? And that is also a very rare case that it might have if you've had if you are currently having the infection. So do not worry that it is going to cause, the vaccine is going to cause you any problem, because these are basically mRNA vaccines, or they are killed vaccine, right? So Covaxin is a killed vaccine or attenuated vaccine. So none of it can actually produce infection enough that it will, cause you to have either infertility or erectile dysfunction issues. So please do not get misled by information which doesn't have a scientific background to it. So please do not get worried about such side effects. There is nothing which is shown when it comes to the COVID-19 vaccines which have been now made available in India. So don't worry about it. All right. Now, a lot of people have asked, I have had infection in the past, why do I need to take a vaccine now? See, because we do not see, one, you must take the vaccine. Now, there are two, three reasons that I can tell you, right? See, taking the vaccine will only reduce can reduce everybody's chance of the kind of severity of illness that can come with it, right? Secondly, because the virus is known to mutate quite a bit, and there are different forms which are coming up. We do not know how it is going to work. So in the current scenario, it is always better that you get vaccinated, right? There is because we do not know how your immunity, which was developed because of the vaccine, because of the infection, post the infection, how long it is going to be with you, because that has not yet been studied. So naturally a vaccine will only help in improving your immune response. So there is only benefit of taking it rather than not taking it. So even if you've had the infection in the past, it is recommended that you still get yourself vaccinated, right? So I hope that that is very clear. And whenever the chance comes and the time comes that you have to get yourself vaccinated, do go ahead without any kind of worry. All right. So and there's an interesting question which has come up. It says that if I have got vaccinated, then I would not have to follow all the precautionary measures, right? So I know it's not very easy for everybody to continue to wear masks and keep washing your hands and maintaining social distancing. But believe me, these are our major weapons, right? Precautionary measures continue, right? We cannot stop them at any point in time. So even if you're vaccinated, it doesn't mean that you should stop doing what is right for you, right? Which means wearing the mask at all times, washing your hands regularly, ensuring that there is physical distancing adequately maintained at all times. Now, one of the also the reasons for this is that the amount of time which has been seen required to build that immune response is anywhere between 4 to 6 weeks, right, post the vaccination. So during that time, also, if you get exposed, there is always a chance that you may still get the infection, because there are two doses that you need to take, right? So it's important that you continue to wear a mask, follow physical distancing, keep washing your hands, taking care of your health. I think these are important steps, and they are best for ensuring that you are protected at all times, right? So follow these measures no matter what, right? Even if you get vaccinated, whenever your chance comes in, right? So great. So I'm just looking at a couple of questions that have come in. Just a moment, right? Um, right. Okay. So yes, there was a question which has come in, which says that can we change brands? So currently, as we have discussed, right, there are um, uh, two vaccines that we are talking about. One is the Covishield, which is the mRNA vector vaccine, and then there is the Covaxin, which is the killed or attenuated virus vaccine. Now, because the way the two vaccines are made and the way they work are different, it is recommended that you don't change the brand that you are taking. So if you are given Covishield, then the second dose should also be Covishield, and vice versa, whatever that is, right? So keep the same. It's recommended that you don't switch brands because the way they act is different. That's the reason. Okay. There's a question about can the vaccination be done at home? I'm 70 years old. Yes. Hello, sir. And you are. Okay. So I'm unaware of that at this point in time, sir, because as I said, the way vaccinations are happening currently is that it's the healthcare workers who are getting it first, then the frontline workers, and then it will be people who are above the age of 50, right? And those who have chronic health ailments or diseases. So I'm unsure of how that is going to happen in terms of doing it at home at this point in time. But I'm sure, if you keep checking the Ministry of Health and Family Welfare website, or if you have the Arogya Setu app with you, you'll be able to register yourself when the time comes, right? Not now, but when the time comes. And then you will know in detail how the vaccination drive will happen for you at that point in time. Currently, I'm unable to answer that question to the fullest, but I'm hoping that that we will have these answers once we reach that, right? India has been phenomenal in terms of getting immunization done for the healthcare workers. We did the largest immunization, vaccination drive, where a huge population was vaccinated on a single day, more than anybody else all over the world. So I'm sure that we are on the right path, but it is going to take time. Until then, please ensure that you take care of yourself, follow all precautionary measures, take care of yourself so that you and your family are kept healthy and away from the COVID-19 infection itself, right? The other thing also that I would want to add at this point in time is, see, even though we are talking about the vaccine, we are talking about giving it, the way the phases are going to happen in terms of getting the vaccine available for one and all. People who do have the chronic diseases, right? And we have discussed about this in the past as well. Uh, you know, it is very, very important that you take care of your chronic disease, right? And manage your chronic disease as well. Um, uh, just because there is a vaccine which is coming in, it doesn't stop you from doing what is right for your health, right? Which means if you are suffering from, say, diabetes, sugar problem, high blood pressure, hypertension, cholesterol issues, heart issues, kidney problems, anything, any chronic disease or chronic ailment, ensure that you are regularly following up with your doctor, ensure that your medications are being titrated, and you are taking optimal treatment for whatever condition that you have, right? It's extremely important that you do that, because that is the only way that you can ensure that your health is, that your general health is under optimal care and control, so that the vaccine can do its bit, right? So take care, ensure that you're taking your medicines on time. Have a lot of older individuals find it very difficult procuring the medicines. You could these days order online, or ensure that it is made available to you at home, so that it makes life easy for older people especially. Ensure that you talk to your doctor. If you're not able to go to your doctor, talk to a doctor on phone call or a video, and ensure that you are following up with them regularly to ensure that your your sugars are under control, blood pressures are under control. If there's any heart disease issue, then take care of that. So you ensure that these are followed up and monitored well, right? Because that's the only way that you will have a good health enough for you to build that immune response also whenever that vaccine is going to be administered to you, right? Now, people who have even who are suffering from cancers, right, it's recommended that they also take the COVID-19 vaccine. Only those who may have, like as I explained, right, one of the contraindications for the vaccine is say low platelet count or any coagulation problem. So if you are suffering from a kind of cancer where these are an issue, maybe then you are not a candidate for the vaccine. But otherwise, everybody who has a immunocompromised or immunosuppressed condition, right? Even people who suffer from HIV, or people who are on, say, long-term steroid treatment for any issue, right? Absolutely recommended that they take the COVID-19 vaccine. It only would help in building your immune response better. All right. Um, just looking at a couple of other things, right? There's a question which says, how much time does it take to develop immunity? As I said, 4 to 6 weeks typically. So ensure that during those times and even afterwards as well, you follow all precautionary measures of, wearing a mask, washing your hands, physical distancing should be followed at all times, right? So extremely important that you do it, right? Um, there was another question. I'm just looking through it. Oh, there's a question. There was a question which has come in that if I take the vaccine, I will get the COVID-19 infection. Again, let me explain that. Right? A lot of people do not understand the meaning of an attenuated or a killed vaccine versus a live vaccine. Right now, what do you again? Currently, we do not have any live vaccines which are there. The intranasal route vaccine is also being tried, but we'll talk about that a little later. But to answer this question, people who are who do not understand the difference between, say, live vaccine and a killed or attenuated vaccine. So live vaccines are those where the virus is in specific diseases it is given, like the virus itself is injected and the body mounts a reaction to that particular virus itself. Whereas a killed vaccine is where it's a uh, dead virus which is being given. So the current vaccine which we have is a killed virus vaccine. So it cannot cause you, it doesn't contain a live virus for you to get a COVID-19 infection, right? So the vaccine will not cause you a COVID-19 infection. It's a pure myth. So we need to kind of understand the difference between live vaccine, live virus vaccines versus a killed virus vaccine. So what we have is a killed virus vaccine. So you don't have to worry about the fact that it's going to actually cause you a COVID-19 infection, right? So don't worry about it at all. Okay. There was another question that COVID-19 vaccine will reduce my immunity. I think I'm not sure. A lot of people see a lot of these questions come from a place of not knowing things and also because of fear, right? Because whenever there is something new happening, we are always afraid of it, right? But let us always have a scientific bent of mind and think logically before we get into the whole thing of feeling scared about new things coming up, right? So no, it's a vaccine. It helps you in mounting your immune response against a particular infection, which is a COVID-19 infection. Now, like that, there are many other vaccines which are available for different kind of preventable diseases, right? Like which are given to children. Like that, this is also one of the vaccines. So this by itself is not going to pull your immunity down or put you at a higher risk for other diseases. Not at all. It will only build your immunity and help you to be able to fight the COVID-19 infection better. So there is no reason for you to believe that taking a vaccine will make you have a higher risk of getting other infections. Not at all. Not at all. It doesn't increase your risk at all for other things, right? So please, don't fall for such rumors. I think these are just rumors, and we should kind of think or try to find the right answers before we fall for something like that. All right. Okay. So I'm just looking through. If there are any other questions, do bring them up. I'll be more than happy to answer them. Just looking through a couple of them, right? Again, as I said, there's a question: any side effects in taking the vaccine? As I mentioned, right? The usual side effects are similar to those which have been seen with other vaccines as well. So, be it say mild fevers, chills, the injection site tenderness or swelling or pain at the site of injection, maybe tiredness, aches and pains, muscle aches. Now, these are some of the common side effects which happen with most of the vaccines that are given. If you have seen your children taking vaccines, you will have a notice that they also tend to pick up a mild fever or any of swellings or any of these side effects. Now, it's important that if you do get these side effects, of course, you need to inform. But usually, say taking a paracetamol usually helps in bringing down the symptoms, so you don't have to worry as much. As I said, with Covishield, there were a couple of other issues that had come up, like the coagulation disorder problem, and hence it is contraindicated, right? If you have a coagulation issue, then please do not take the vaccine. And in very, very rare instance, there was one instance where there was a neurological issue, a demyelinating disease that had come up, but it is under it has still been researched as to how it happened or why it happened. Was it truly the vaccine which was the cause of it versus something else, right? So those details are still not out in public domain. So when it comes up, we will be able to understand it better. But overall, the kind of side effects that are seen are very similar to side effects that would be seen with any other vaccine. Okay. Again, there's a question which says COVID-19 recovered patients, can they take the vaccine? Yes. Yes, as I would want to repeat this again, right? If you have had the infection in the past, you must take the vaccine. It is only good for you because it will build the right kind of immune response that is required for you to protect yourself better, right? So please do take the vaccine. However, if you're currently suffering from the infection, like during the time of the vaccination, you are currently suffering from the infection, then you need to wait for at least 4 weeks before taking the vaccine. So do not take it now if you are currently having the infection. But if you have been recovered in the before 4 weeks, if you have had infection at any point in time, please do take the vaccine. It will only help you in the long run, right? So I hope that most of your questions would have been answered by now. If there is anything else, do keep asking, because it's always nice to get back and clarify any doubts, right? Now, a couple of other things that I would want to mention here is a lot of people want to know about the intranasal vaccine which is getting tested, right? So there's a new vaccine which are in market, which are being talked about. I'm sure that you have all seen it in the news. These are intranasal vaccines, which will be basically not a prick. Like currently, the vaccine is where you are getting an injection, but this particular vaccine, which may come out, is going to be in the nose, like a spray. Like you would put a nasal spray like that. This is going to be an intranasal vaccination that is being talked of and being tried. And we're hoping that this would be a very interesting, or it would be a game changer, because intranasal vaccines can be very easily administered by even non-medical professionals, right? So currently, vaccinations has to be the at a large scale vaccinations. Currently, one of the challenges is that it has to be given by a medical professional or healthcare professional, right, who would be able to give the injection. But I'm hoping that the intranasal vaccine is out and commissioned very soon, so that it will help in mass vaccinations at a large scale, right? So let's hope that that is out at the earliest for all of us. Now, a lot of people have questioned about the how true is this vaccine, because these vaccines have come out way too fast. Somebody has this question that these vaccines have come out, have been developed very quickly. So, how efficacious are they, or are they really unsafe, right? So, see, we have to understand that this is a global emergency, right? I think every country has been trying to ensure that we curb the spread of COVID-19 infection, and we try to decelerate it or stall it at the earliest, right? Now, the vaccines which have been out in the market, definitely all of them have to go through some form of quality checks, right? Without that, it does it, right? As I was trying to explain to you that usually with vaccines there's the non-human trials and then the human trials, which happen in three phases, right? So all the vaccines, now the ones which are in India are only the Covishield and the Covaxin, but then others are also would come in at some point in time. So there's a vaccine by Pfizer, there is a vaccine by Moderna, there are other many vaccines which have been developed by different countries, right? Now, all these vaccines have undergone these trials, right? And the results have been published, and the commissioning of the vaccines happen through specific channels, right? There are authorities who commission it, right? So for WHO, the efficacy has to be above 50% for it to even be allowed in the market. Now, those all of them have undergone phase 3 trials. The as I was saying, that Covaxin is undergoing the phase 3 trial at this point in time, but still in the phase 2 trial, the efficacy was more than 50%, and it has been kind of, because of emergency circumstances, it has actually been commissioned for use, right? So, it is, the situation has been unprecedented in my opinion, right? And I hope everybody agrees to that. But because of such a situation, there has to be a collaborative work, and people have to work in maybe a shorter time frame when it comes to development of the vaccine itself. But yes, all vaccines which have been out have undergone the phased trials, and we're hoping that um, very severe side effects may not come up, or when it is in the community. But let us watch out, and try to see how data comes up as the vaccination drive is being going is out and about, right? So we will be able to understand that much better as data comes out, right? So hope that answers your question. I know it's a difficult situation a lot of times. We are we are doubting this, right? And I understand that uh, it's a valid doubt, but we also need to understand that this has come out with a lot of hard work from a lot of people, and it has shown efficacy in most people, right? So let us hope that it works for all of us at a very large level, and only makes us safe, and build our immunity against the COVID-19 infection. So let us hope that. But do not worry in terms of the way the efficacy of the vaccine itself is going to be, right? So I hope that answers that question, right? So any other question that you might want to add on at this point in time? And I'll be more than happy to answer that. I'm just looking through it. Yeah, somebody again asked the same question: what kind of vaccines are available? As I said, the Covishield and the Covaxin, which are available currently. And it is, as I said, it is a phased manner in which it is going on. So the healthcare providers or the frontline workers are those who are being given it at this point in time. So let us hope that for general public, when it will come out, it's a good question that you've asked. Once the healthcare workers, the frontline workers, then it will come to the general public, specifically to the senior or elderly population and people above 50, or those with any kind of comorbidity. That means those who are suffering from sugar or high blood pressure or any of these issues, they will be the ones who will get it before the general healthy population. So that's how the phases in which the vaccination is going to happen. So we will have to be a little more patient and wait it out for the vaccine to come out, right? So till then, I think I keep saying, keep mask yourself, use your mask, ensure that you are protected at all times, and you take care and take precautionary measures so that you do not get the infection, right? um, yeah, somebody asked about getting back to work, when they can get back to work. Absolutely. I mean, that is one of the um, you know that's a question that we always, and we are doubting it, but we'll have to at some point in time. So yes, a lot of people are getting back to work, a lot of offices are opening up now for work. And my recommendation is that um, if it's absolutely necessary for you to be in the office, yes, of course, should go with all precautionary measures, ensure that your office spaces are taking the right kind of steps to ensure safety in terms of cleanliness, sanitation, availability of physical distancing between desks, and cleaning of rooms, and availability of sanitizers, and so on and so forth. So they should all be there when you're getting back to office. But at the same time, vaccines are still, it will take a couple of months before all of us get vaccinated. So we will have to wait it out. Until that time, take care of yourself. If you have to get to office, please do, but follow all the precautionary measures. If there is a way in which you can have a balance between working from the comfort of your house, or where there is where you are more comfortable, or feel more protected, then yes, you, and if you can exercise that choice, please do. It always helps, to be more comfortable that way. But if you're getting back to work, you have to follow all precautionary measures. There are no two ways about it, and you have to keep doing it even after you get vaccinated, right? So that is extremely important for all of us to know. Okay. I see that most of the questions are done. So do let me know if you have anything else that you would want to know from me when it comes to vaccines. Just to summarize, currently there are two vaccines available. One is the Covishield, one is the Covaxin, one is a mRNA vector vaccine, one is a kill virus vaccine. Both of them have to be given as 2 doses, 0.5 ml, in the muscle on your arms, in the deltoid region, and the 2 doses have to be given 4 weeks apart, right? Both of these vaccines need to be in, kept in storage, proper storage and cooling. So usually a 2 to 8 degrees centigrade, not more or not less than that, is the kind of the cold chain that has to be maintained for both these vaccines. These vaccines come in doses vials, right? So it's not a single dose vial. It will come in either a 10 doses or a 20 dose. So when vaccination is being carried out currently for healthcare workers, it is usually done where there are multiple number of people, and they'll be lined up one after the other, so that one vial is finished, after that the next one gets finished. So those are the kind of things which are currently being followed. If you will get a kind of a certificate which says that you have been vaccinated, the first dose has been given, when to come for the second dose, and when that will be given. So it's also important. I think one of the things that will happen going forward is we will all have to have certificates which talks about us getting vaccinated, and that is going to be important when it comes to travel. If you have to travel or go somewhere else, especially travel out of the country or get into the country, having these certificates would be made mandatory at some point in time, because that is how it started. The spread started that way, right? So all of us will need to get vaccinated at some point in time. So ensure that we will ensure whenever that happens. I'm sure that you will come to know when that is. But as and when, keep yourself informed. You could go to the Ministry of Health and Family Welfare website, or you could read up online as to when the COVID app is going to be available for general public as well, right? So that is something that you can do. Now, in terms of side effect profile, both the vaccines are known to cause side effects such as, say, fever, chills, aches and pains, tiredness, myalgias. So which settles, which settles with simple medication or a paracetamol. So don't worry about them as well. Okay, there are a lot of myths around it. Please do not fall for it. Vaccines do not alter your DNA. Vaccines do not cause infertility. Vaccines do not cause any erectile dysfunction issues. So do not fall for such myths. They only make us more scared, and they prevent us from doing what is right for us, right? So please do not fall for such myths. Even if you have suffered the illness, ensure that you get vaccinated. And it only will help you. If you are somebody who has chronic diseases, please get vaccinated. It's very important that you do. Only contraindication would be at this point in time, children, pregnant women, lactating women. It's best that you avoid taking the vaccine because not enough trials have been done. Also, those who have say coagulation issues, or who have a low platelet count or have coagulation disorders, those should refrain from taking the vaccine. But otherwise, I think everyone should take the vaccine. It is going to only help us, and it's going to protect all of us. It is going to protect the whole community and the whole country. So I think it's extremely important that we continue, and we believe in the vaccine, and we do take the vaccine and register ourselves for the vaccine as and when it opens up. Okay, so I hope that I have answered most of your questions. I do not see any new questions coming up. So, if there's anything else, you can always ask, and I'll be always there to help you out. But till then, do take care of yourself. Ensure that you follow all precautionary measures. You follow wearing the mask, physical distancing, hand hygiene. These have to be maintained and followed at all times, right? There are no two ways about it. Please do that. If you are getting back to work, follow all the precautionary measures. Take care of your health. Ensure that you are physically, mentally, socially doing well. Reach out to your doctor if you have any issues. Talk about it, because that is the only way that any problem can be solved, right? So until then, take care of yourself. Stay safe, stay healthy, stay happy, and take care. All right. So, good day. Thank you so much for being here.
Download the MediBuddy app now. Subscribe to our YouTube channel for more updates.